Hello and welcome to another Medical Monday. I'm Dr. B and I'm here with my buddy Joe Haverly. He is a nurse practitioner that also works at Just for Kids and is, in addition, a fireman. We consider Joe our resident Superman. If we need anything, we call Joe.
Okay, great.
You know, you've seen a lot of respiratory distress in your job with your transport medicine role, but then also as a nurse practitioner. So what are some things that parents should be looking for, thinking about when their kid starts having a really bad cough?
We see a lot of people come in with really bad coughs, and most of the time the cough is pretty benign, but we do worry about some coughs that seem to be worse. If you were coming to see me, I'd be wanting to know things like, what does this cough sound like? Is it really dry? Is it wet? Is it barky cough or deep? Things like that would help us to know how serious might this cough be.
One of my first questions I like to ask moms, because I think they can relate to this, is are they able to sleep, right?
Oh, right.
So when you hear about that baby or child who was up all night coughing, can't get to sleep, that's definitely a concerning sign on my book when I hear that.
Some of the other things we'd want to know about are whether they have a cough or they don't have a cough. Are they having any other respiratory difficulties? Like are they having wheezing? Do we need to take a look at their chest? And retractions indicate that the patient, in this case our pediatric patients, are having a pretty hard time breathing.
So explaining to parents what a retraction is like, okay, so when you look at them, they're actually going, their chest is moving up and down. You can see movement of the chest wall. They're not just comfortably sitting here breathing. And so what Joe was talking about is to see their chest is like sometimes you really do need to lift their shirt up, right?
Right.
And get a look at their chest wall. See if the muscles are contracting. See if it's contracting up here. See if it's contracting on their ribs. If their belly's going up and down. That's a sign usually that they need to be coming in. If you're seeing retractions, they should be coming in. There's others more subtle signs in somebody who has been having retractions and we've been treating you, and then, you know, maybe we see something, you know, coming up like they sort of disengage, right?
Right. They'll disengage instead of maybe making good eye contact with you like your child usually does, but maybe look past you or in front of you. Their focus seems to be a little bit off, and they just seem really, really tired.
To me, that sort of signifies low oxygen level.
Yeah, I agree. I would be worried about low oxygen levels. One of the things that we need to check. We also have to wonder how are they feeding, especially the little ones who are still breast or bottle fed. How are they doing with that? Can they eat, or are they unable to feed because they're struggling to breathe so much? So
just to review, some of the things we want to look for: sleeping comfortably, at least briefly. They may wake up some, but if they're able to stay asleep for more than an hour or two, they're usually doing pretty good. But a concerning thing if they really can't feed, you know, particularly a newborn who's nursing and has a really hard time. If they can't breathe through their nose, they can't really feed well, but we may need to see that kid. And then wheezing and looking at the chest wall is a great way to assess your child, and sometimes that gives you a lot of information. We realize that, you know, RSV and flu and these upper